Hi, my name is Chris. I'm a level 1 nursing student. I'm here to follow you with Shanae O'Connor. Can I get an SPAR report, please?
Sure. She's a 34-year-old female. She weighs 177 pounds. She's a full code. She has an allergy to trimethoprim. She has renal disease, so that puts her on a 1,500 milliliter fluid restriction diet. She is a low risk for falls, and she's not a risk for pressure sores. She came in with a fever and an undetermined origin, and that secondary diagnosis would be end-stage renal disease, which she was diagnosed with a year ago. She's on regular dialysis. She has type 1 diabetes and reports that her blood sugar has been elevated over the past few days. She had a graft infection 3 months ago, which was resolved with IV antibiotics. She has a history of recurrent UTI and reports Perla was good, no problems with her ears, mucous membranes were clear, without lesions, gums were pink and firm, and she wears glasses. Chest expansion was symmetrical, all lobes were clear, and she quit smoking 2 years ago. She does have an increased heart rate, but it's just S1 and S2 present, no murmurs or any other abnormal sounds. She has a slight 1+ non-pitting edema in the lower extremities, and her femoral pulses were 2+ bilaterally and 1+ pedal on both feet. Capillary refill was less than 4 seconds. Her abdomen was soft, round, and non-tender, no visible masses, sounds present in all 4 quadrants. Patient reports weight gain of 10 pounds over the past few weeks, and she has a decreased appetite, which leads to decreased intake. Patient reports a recent decrease in frequency of urination and volume, and the urine has recently become more concentrated, darker in color. Her last vital signs were taken today at 7:30. Temperature was 101.1, heart rate 95.02, stat was 96%, blood pressure is 136/78, and respiratory rate was 20. Her last AccuCheck check was today at 7:30, and her blood sugar was 155. She has an IV in the right medial vein, which is 18 gauge, and that was put in on Monday. She had a urinalysis come back. Cloudy urine, pH was 4.7. There was no protein in it. The gravity was 1.005. So we're gonna treat for a UTI. And her white blood cells count was elevated at 15.
Bear with me, I'm sorry.
We're also waiting on a CBC metabolic panel, urine culture and sensitivity. And we're going to be giving Primaxin as a piggyback today to treat for that UTI that we think she has, just to start the treatment. Do you have any questions?
Why specifically, again, is this client receiving this medication, and what action does it have on the body?
So we suspect that she has a UTI, so this is just going to begin treatment instead of waiting. There's no harm done by beginning it. And it's going to bind to the bacterial cell walls and cause the cells to die for that bacteria.
When should you question administering this medication?
So you want to check the patient's allergy wristband in the MAR, or the medical record, to make sure that she doesn't have any allergies to the medicine. If she had an allergy like penicillin, you wouldn't want to give the medicine.
Does the medication have a therapeutic serum level?
It does not.
Which vital signs must be monitored?
So you want to look at all the vital signs and make sure they're not increasing, which would indicate that the infection's getting worse, and you want to try to prevent a super infection from happening. And if you did notice that they were increasing, you would want to report that to the doctor.
Which physiological parameters should be monitored when the medication is being administered?
So you want to look for things like rash, edema, or any signs that show she's having an anaphylactic shock from the medicine. Some labs that you would expect to go up with this medicine are BUN, AST, ALT, things like serum alkaline phosphate. And then H&H might decrease with this medicine. You also want to monitor the temperature, make sure it's decreasing.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So they want to look for the 5 R's, which would be the right dose, right route, right time, right patient, and right medication. That make sure the nurse is going through all that before giving the medication.
What interventions must be taught for taking the medication safely at home?
So if they're prescribed antibiotics at home, you want to make sure that they continue with the full dose and don't just stop when they feel that they're better. You want to make sure that they're taking it at the same time. They should know signs and symptoms of adverse reactions to this medicine and report that if any of them occur.
What are the side effects and potential adverse reactions?
So things like diarrhea, nausea, vomiting, rash, constipation, serious one would be like seizures.
How will you know the medication is effective?
So if their temperature decreases, it shows that the is one sign that the infection's getting better. White blood cell count should go back down to normal. Pain goes away.
All right. That's all the questions I have.
All right.
So we're gonna watch for 5 drops.
Come in.
Hello, my name is Tom. I'm going to be your nurse for the day.
Okay.
Can you tell me your name and date of birth?
Shanae O'Connor. I'm 34 years old.
All right, let me just look at your wristband here. And you have an allergy here. Is there any other allergies you know about?
No.
All right. Alright, so today you're going to be getting the Primaxin because we suspect you having a UTI from your labs that came back. Have you ever had that medication before?
No.
Alright, so I'm going to tell you some side effects. So you want to look for things like diarrhea or if you're feeling sick. So just report that if you feel that. Alright? I'll also give you some reading that you can do on the medication that will help you.
Okay. And did this information affect your decision to administer the medication? Yes, because it gave you directions on how to do it correctly and to provide safety for the patient, especially because it is going into a vein. Okay. And did this information affect how you administered the medication? Yes, because had I not had it, then I wouldn't be getting it the same way. So, okay. All right. I'm just gonna go ahead and keep charting.
So that's going to be RAM with normal saline.
Okay.
What did I miss? You didn't label the person that was using. I didn't think you needed to. Then what time did you keep it? Because it's going 30 minutes.
Just going to compare this to the MAR. Expiration date's still good. Sodium chloride, 9.
I wasn't sure. I don't think it's a big deal, but what did he say in his video? I don't know if he really does that.
Can you tell me your name and date of birth?
Yes. My name is Shanae O'Connor, and I'm 34 years old.
I think he just labeled the question.
Scan that one more time.
Hang on.
So this is sterile. You want to keep it sterile.
It's alright, let's just leave you on I did all mine in 9 minutes, so it does take a while.
And we're going to run it through the line to prime it so that there's no air present. And
I watched, like,
that tip's sterile, so we're gonna test your IV. Scrub the hub 15 seconds. 5, 10, 15. Check this. That's good. And this is primed. Disconnect. 5, 10, 15. This end is sterile. Took it out. Took the cap off. Medical surge, yes. And let me see your wristband. 84233 43660. We're gonna go channel select, Guardian IV fluids, 0.9 normal saline, yes. And it's going in at 30 milliliters an hour. So rate is 30. This is a 500 milliliter bag, so we'll do 475. So it alarms before it runs out. And it's gonna check here on the clamp.
You know what? I use it on always. Yeah, right here. Hey, Tiffany. Damn.
I'm gonna check the 5 drops. We're waiting, I'll get a label. There's 1, 2. The date and time here so they know when to change it. When it was 3, 4. That's 5.
Where's the son live? You think he's married? You said that, right? Thought so. No, I said she has a son.
I'm gonna document a little here real quick. next we're gonna hang the Crimax in here. Can you tell me your name and date of birth?
Nene O'Connor, I'm 34 years old.
Thank you. Gonna look for the expiration date. It's still good. Make sure the medication's the right color. It should be. It's, make sure it's the right medicine. So that's right. So take the cap off. It's still sterile. Scrub the hub here before connecting it. Piggyback. 5, 10, 15. Send sterile. Connect it. And we're gonna backflow here.
Yeah. Piggyback, I think. Okay. Okay, so can I get an SR on the patient?
Alright.
So,
And then we wanna hang
I believe in the mission.
this medication lower
She's ready to
so that the Primaxine goes in first. And we're gonna do channel select, secondary, and that's gonna be 500 milligrams over 100 milliliters. That's correct. And we want it to go in at 100 milliliters an hour. Get mine. So we're gonna check the 5 drops again. I'll start and I'll label the tubing. Date, time, and my initials.
As far as her heart, she's a little bit of tachycardic, so her S1 and S2 are present. With regular rhythm and numbers are extra heart signs. Capillary refill is less than 4 seconds. And she has some slight one-plus mounted edema in the lower extremities. Fetal pulses are 1 plus in both feet, and she's denied any chest pain or palpitation.
It's 1,
She is on a renal diet and a 1,500 ml fluid restriction.
2,
She does report a recent weight gain of about 10 pounds over the last 2 weeks. And like I said, decreased
3,
appetite and decreased intake, obviously. She denies any abdominal pain and denies
4,
pain about
5.
habit. Abdomen was felt
Alright.
in December without any visible analysis. Nor
I'm going to give you some information here on some side effects of the drug that you can look over.
Alright.
And will you be able to tell me the side effects I told you earlier?
I think you said allergic reaction, maybe diarrhea.
Diarrhea, nausea, vomiting, things like that. Alright. Do you have any questions?
Nope.
Alright. I'll come back in and check in you in a little bit, okay?
Okay.
Alright.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
So I wanted to make sure that the client didn't have any allergic reactions or anything that would cause a problem with giving this medication. Also looked at the date and checked the orders before giving the medication.
Did this information affect your decision to administer the medication?
Everything was in check as it should be. The IV site was still good. Checked that. There wasn't any allergies, so I gave it how it was prescribed.
Did this information affect how you administered the medication?
Once again, no. After checking everything, it was all okay, so the order went with what the order said because everything lined up.
All right, those are all the questions I have.
All right, thank you.